Good afternoon, everyone, and welcome to this instance of SC Thrive's Senior Spotlight webinar. We hold these webinars quarterly in an effort to let you know about some of the wonderful things that we have going on here at SC Thrive, particularly in relation to seniors, and that's exactly what we're going to focus on today. First, let me introduce our team who you'll be hearing from today. I'm Beth DeHart, the Director of Senior Programs here at SC Thrive. Also is my colleague Tasha McClendon. She's up in Greenville, and she's our Staff and Veterans Coordinator. And we have a very special guest, Samantha Drains, who we'll tell you a little bit more about momentarily. On the Senior Spotlight webinar today, we're going to focus on Healthy Connections Prime, which is one of the senior-related programs that SC Thrive promotes. And just as a quick refresher, if you haven't heard too much about SC Thrive so far, we are a statewide nonprofit, and we exist to help people get connected to resources toward a better quality of life. We know that seniors in particular have needs, that many benefits are available to meet those needs, and that's why we exist in the senior department to help those seniors make those connections. So Tasha is going to spend a few minutes with you explaining a little bit more about Healthy Connections Prime.
So Healthy Connections Prime is a wonderful healthcare option for dual eligible seniors. That means that you have Medicaid and you have Medicare, and it opens up a whole new possibility of different benefits. So with Healthy Connections Prime, one of the benefits of this particular healthcare option is that there are zero monthly premiums. There are zero copays for doctor visits and hospital stays. There are zero prescription drug costs. There are zero deductibles. You get a personal care coordinator who helps you with whatever you might need as a senior. They put together a care team, which is approved by you, and it covers all your needs under one roof. So you don't have to have dual cards like a Medicaid card and a Medicare card. You have one card, you have one team, one point of contact, and this Healthy Connection Prime is an awesome healthcare option. But we're going to learn a little bit more about what a care coordinator does in Healthy Connections Prime with our guest today.
Awesome. Thank you so much, Tasha. Healthy Connections Prime sometimes sounds like it's too good to be true, but it really isn't. It is, as Tasha said, a wonderful option for seniors who are eligible for both Medicare and Medicaid. And there is no eligibility beyond that. You just enroll, and SC Thrive is available to help you do that. We are speaking right now to seniors who might be listening, but also to loved ones who may be caring for an aging family member or neighbor, friend, either way, and also any service providers who might be listening as well. We definitely want all of us to know as much about Prime as possible. So moving on, we would love to introduce you to Samantha Drains. Samantha she has served in a variety of nursing roles for, oh my goodness, 38 years. She's got so much experience, and I'm so excited to be able to hear from her about some of her success stories in her role as a nurse. Her current role is as care coordinator, and as a care coordinator, she coordinates services for Prime members. The services can range from locating primary care providers, assisting with durable medical equipment, assessment of the member, monitoring medication for compliance, routine screenings, locating resources, assisting with waiver services, or even just talking with the member for support, which is, I would expect, one of the primary things that the members look forward to. Her journey in life is to help those in need with kindness, encouragement, and hope by supporting the needs of members, families, and the community. And with that much experience, I know she's got some great stories. So Samantha, thank you so much for being with us today.
Thank you for having First Choice VIP, and I'm the representative for them, but thank you so very much for having me.
Absolutely. And thank you for making that point. There are 3 plans that offer Prime, that cover Prime in our state, and Samantha is with First Choice VIP Care Plus. So Tasha and I talk about Healthy Connections Prime a lot, just out and about in the community with people. But we thought it would be a wonderful moment to give you guys some insight into what it looks like for a member to have Healthy Connections Prime. What does it mean? What benefits do they actually experience on a daily basis? So let's just start out with some good news. Samantha, if you would, could you share a couple of success stories in your role as care coordinator with Prime members?
I sure will, Beth. I have so many, but these are some of the recent ones. So I'm a care coordinator, and I usually have about 200 members. All of us have about the same amount. But one of my members, she's 68 years old, and this is when the outreach, reaching out to the members, so very important, and being able to listen to them, have a relationship with them. But this day, I contacted a member and change of voice. I knew right away that something was actually wrong with her because on my previous call, she's upbeat, she's wonderful. But this day, she was very sad. And so I questioned her just to see what was going on. She said her significant other had passed. The significant other passed while she was in the other room. The dog was trying to reach out and wake him up, and the dog went and got her. So it was a very tragic moment that she found him. But one of the things when she actually was telling me, I'm listening to her and I said, okay, this is urgent little crisis here. Let me reach out to the family. Unable to reach the family, call them numerous times, because she's very sad at this point. She's just sobbing. And then I said, okay, someone has to reach out to her. I actually contacted the local hospice agency and I was able to get a grief counselor and I explained to the grief counselor what was going on. She immediately contacted the member. And so she has been following this member probably for about 3 or 4 weeks now. The member is going through the stages of grief. She's still in the stage of depression, but she has a contact, a resource besides her family now that actually did a face-to-face visit and follows her with a phone call. I am, on the other hand, I contact her also just to make sure that she is getting those calls from that grief counselor. How can First Choice help her? Right now, she's good. She's satisfied with the service. I told her you can call me anytime, however you feel, just give me a call. And she has actually did that because this is one of those members that really did not even answer her phone. And when I was able to go through all the resources to reach out to her, she said to me, I am so happy that you were able to reach me because this is the connection that we want to have with all our members, to know that something is wrong just by talking and listening to their voice and, and listening to the surroundings in their background. So it's very important for the care coordinator to be there for our seniors. So that's one story that I actually have.
What a wonderful story, Samantha. And wouldn't we all want that? Just someone to reach out and check on us if something was going wrong. Oftentimes when we're out and about talking about crime in the community, we refer to the care coordinator as like a caring daughter-in-law, someone who's not related to you necessarily, but someone who cares enough to check on you and exactly what you just did to notice if something is going wrong. That is a powerful story. And Samantha, I mean, I know you probably didn't study that kind of care in your BSN,
I
but
did not.
but it's as important as anything else, I would think. So, gosh, that's wonderful. Do you have
I,
another success story?
I do. The second story is this is when you have to have a relationship with all the vendors, whether it's internal with us or external. It is so important to have that relationship with the hospital, with the DME company, with the hospice, a grief counselor. It all comes together when we work together and it helps the member. So this member, I think I lost. Oh, there I am. So this member, quite challenging. I received this member as, on my caseload, and I went to reach out, and I was able to contact the son. They're Hispanic. And so the first challenge we're going to have is the language barrier. Fortunately, he could speak English really well, and I was able to communicate with him. This member has a severe dementia, very severe, probably Lewy body, and that's a dementia that it just mentally, it just destroys everything, not only the mind, but actually the body also. So they were struggling with trying to care. Uh-oh. can you hear me? They were struggling with trying to care for his father. He's the only child, and the mother. The mother, the wife, was exhausted. I could hear just so much exhaustion in her voice. So after I did the assessment and everything, I said, okay, we need to do a community long-term care referral. But just finding out this member, and this is just sometimes what happens when you don't have that care coordination or someone to coordinate your service. The family had applied for community long-term care back in 2019. They had not received it, and they applied in 2020 and in 2021. So by the time I got them 2022, I said, okay, this needs to be expedited because they've been waiting for so long. The member is just not doing well. I was able to connect with all the vendors, contact the local community long-term care office. She provided me with a Medicaid director. I contacted the Medicaid director, which was awesome. Told her what was happening with this member, and she did the research within 48 hours. He had community long-term care. She expedited, she realized, she said she did not know what happened. She expedited the case. He had everything that he needed within the 48 hours, so we got it all started. Now they have all the services. They're doing well. They are doing well. Even though there's a language barrier, it the wife can speak a small amount of English, but the son is my contact. We have the waiver case manager. All of us have to work together to help this member, and that is what has happened. So that is one of the cases that I was just so excited that we could reach out to the Medicaid director, and she listened to me, and she researched while I was on the phone, and she took care of the member just like that. So that was the biggest thing ever for this year for me, that he was able to get service.
You are true to your title, Miss Samantha. You are coordinating care. You are truly a care coordinator. That's amazing.
Mhm.
I could listen to these success stories for the rest of our time together. That's wonderful. How important I just can't how important your work is. It's just amazing. So let me just say thank you. Thank you
You're welcome. It
sharing.
is so important that we're here for the seniors because this health journey is to navigate it is very difficult. But if you have someone that you can reach out to every day if they like, we're still here to help them, whatever question they may need.
Wonderful. Wonderful.
So, I would like to ask you a quick question about medical providers. Can you explain the process if a medical provider does not accept a prime plan, and what happens? This is a question that we get a lot, and we'd love to have an answer to be able to help people.
Okay, so if a member comes onto our plan and they have a provider that's not in network with us, they actually can see that provider for 180 days. There's no, we're going to pay for them to go see that provider. After the 180 days, they're working on trying to get that provider in our network. But and it's a provider choice, if that provider states, I do not want to become part of the plan, there's an option. And the option is to do an authorization. So any provider that's not in network with us, the only thing we have to do is request an authorization. I do encourage if a member, and I know for myself, if I've had a provider and I do not want to change, I feel comfortable with them, that is the greatest thing, and we want them to keep that provider. But the only thing they have to do is, and usually I kind of walk them through that and help them with that concern, is just request an authorization. And for the visits, you can request visits for, like, I do encourage them to do 5 to 7 visits at a time. So every time they go every month, they don't have to request that authorization. They'll automatically have that 5 to 7 visits already approved. So, and now that it's COVID, there is no authorization required. But Some other providers still request an authorization, and we still provide them with that authorization. So it does not matter as long as the provider will accept that authorization or become network, the member is going to be taken care of.
Okay, so this is a really important question, and I really want to make sure we understand it properly. So, because you're exactly right. I don't want to change my doctor just because my insurance might change, right? We have a sort of a relationship with our provider. So what you're saying,
Right.
Samantha, is if a person enrolls in Prime
Mhm.
and discovers that their healthcare provider doesn't take the plan that they've signed up for, that you, the care coordinator or the plan, will work with that provider to take your coverage. And if
Mhm.
they refuse to, for whatever reason, you can go like visit by visit and get
Mhm.
each of those visits authorized, so that eventually the takeaway is that the enrollee, the member, isn't having to pay those costs, right?
That is correct. So if the provider becomes network, awesome. If the provider declines, there's authorization. That's part B. So you have A, provider and network. B, non-network provider, authorization. That's all we have to do is provide an authorization.
Okay.
And we do encourage them. And when I reach out to them, because they're all about, am I going to receive payment? That authorization guarantees that payment, and that member on the card, member cannot be charged. If that member does get that bill, the member just need to contact the care coordinator or the member service, and they will take care of that bill for them. They'll contact that provider. So at
Okay.
the end, the goal is the member cannot be charged.
Wow. Wow. That's wonderful.
Mhm.
Okay, so you just touched on something that I wanted to follow up on. I know that at the South Carolina Department on Aging, there is the Prime Ombudsman. And so um, if a client does have an issue of some sort that they can't get resolved, and maybe you can't get resolved with them, can you explain the process of what the Prime Ombudsman might do to be able to help?
So the Prime Ombudsman is very great for the members to know about, because if they have any issues with their provider and we're not resolving it, if they have any issues with complaints, filing a grievance or appeals because of something that First Choice have not provided for them, that ombudsman is the mediator. So every month, our managers, along with that ombudsman, I guess at this meeting, and if there are any concerns, they let us know, and the ombudsman kind of walk the member through what process they need to take. Either if they need to do a hearing, but most of the time it doesn't get that far. Once they notify the ombudsman with that complaint, they're going to notify us, and then we're going to work on it to resolve that issue for that member. There's really nothing that we cannot resolve. We try very hard to resolve anything that the member has occurred, grievance, appeals, they're not happy with the provider, they're being billed for some reason, but the ombudsman is their resource. We also have someone, they're not called the ombudsman, but internal. We have the patient care connectors, which also kind of acts just like the ombudsman, because they can take care of all the issues. The member just need to call in the member services. If they have agreements, they'll file those agreements for them and walk them through the process. So they have so many resources when they're actually coming on to our plan.
So it
The
sounds like
goal
there
is,
are several different safety nets there to help the
safety
member.
net, there's always safety nets, always. Safety nets with the ombudsman, because she is the mediator between our plan and the state. And then we have our own patient care connectors that kind of mediates and makes sure that the member's taken care of also. And then you have a care coordinator. If the member reaches out to us, okay, that's another resource that we're going to help that member.
Samantha, is there any difference in anything that you just described when it comes to medicine management or pharmaceutical coverage? If maybe a pharmacy doesn't want to take the plan, is there any difference in how the medicine management is handled?
Okay, so with the medication management, we do like their providers to manage their medication, but here we go. We have these steps. So we have our own pharmacy. And what I do, if I'm reviewing their records, because we have to review their records, their medication, their appointments, their streamings, everything. So if there's a problem with the medication, I am going to immediately contact the pharmacist. The pharmacist, they have a program that they can outreach to the member and the provider to let them know if there's a red flag with the medication. Like there are a couple medications that are fall risk. We're very concerned about the drugs that are fall risk. If a provider orders a fall risk drug, immediately that pharmacy is going to reach out and to make sure if there's another drug, another compatible drug that they can use. So with the medication management, again, they have that safety barrier. There's a problem with the medication, I'm going to notify the pharmacy. The pharmacy is then going to put them on a medication management plan, and they'll reach out to that member to review. If that doesn't work, they're going to reach out to the provider.
Gotcha. Gotcha. So again, it's that coordinated approach between the provider and you and whoever else they're trying to bring in to serve the client, right?
To serve the client. If a provider orders a medication and for some reason, and sometimes this does occur, they need authorization. The member calls me and say, my medication is not approved. The medication is not approved by us. There's something missing. Maybe the drug is not on the formulary. But again, there's always an authorization. So they will, if a medication is not on our formulary, I will reach out to the pharmacist. The pharmacy will tell me, okay, it's not on the formulary, but we can get an authorization. The member themselves can start that authorization for the medication process. And then the pharmacist will reach out to, our pharmacy will reach out to the provider to get the additional information to approve that drug.
So again, it sounds like that safety net is in place in case it's needed.
Yes.
Awesome. Tasha, did you have a question?
Yes. If you could tell our listeners why you feel Prime is a good option for seniors, what would you say?
You know, I love my job. And I think when people love their job, they're going to go above and beyond to help the seniors. I am a senior person. I often think about myself becoming a senior, which is going to occur. I want someone on the other end to, when I call and do not know, I want that person to be able to help me. I want a live person. I do not want an automatic made system. I want somebody to help me immediately. And that's what we offer. Not only that, we want to empower the member to do things for themselves. That's the greatest thing. We want to encourage them. But if it does not occur, they have us to help them. And that's what we're here for. We want them to have a great quality of life, which when I get that age, I want to have a good quality of life. I want to make sure that all of my health needs are taken care of and that I can do all I can with my family, my grands, and whatever else I want to do in life when I get 80 plus years old. I just want to be active. And that's one of the goals for us, to make sure the members have a great quality of life and that we're here to service them. And I want that for every senior, but for our seniors, it is 65 and above, and they must be dual, Medicare and Medicaid. And all of the seniors that I have dealt with in my area, and I'm sure the others too, I've had them, most of them for 5 years. I've been here for 5 years, and I've had them for 5 years. So I've had maybe one or two to go off, but those one or two come back on. So yeah, I just love this job.
Yeah, and I love that answer to the question. The question was, what would you say if we were trying to talk to someone about whether or not Prime is a good option? And your answer is, because I love my job. That's a perfect answer, because we could go through data and we could go through outcomes and all of that, but ultimately the person who is on the other end of the phone trying to check on the senior, helping the senior, if you care, then all of that other stuff will just fall into line. Perfect answer. Thank you so much for that.
Every time it falls into line. And like I said, we're here to encourage them. No matter what they're going through in the day, it may not even be medical needs. We're still here for them.
Beautiful. Beautiful. Samantha, is there anything else that you would like to tell our listeners about Prime or your job or anything before we close?
I just think if you have a loved one that is dual, I think this is an option for the dual member. I think you should try it. I think it's a great, great service. If I had parents that qualified, they would definitely be on the service. And just give those options a try. There are 3 plans out there, but you can try us all. And one good thing, if you don't like our plan, you can always go to another plan. We never, ever stop you from going to another plan. I know you're going to come back, though, but but we don't do that. So, those are our sister plans, and we'll applaud them also. So all the plans are great.
So Samantha is with First Choice VIP Care Plus. Then there's Molina in the state, and then there's also Select Health. So those are the 3 plans that are available in our state. And I did want to, before I pass it over to Tasha to close this out, I did want to make sure everyone knows. Samantha mentioned it a second ago, you need to be dual eligible. So if you're over 65, Medicare should be situated. But what about Medicaid? If you don't have Medicaid yet, SC Thrive can help you. We have our call center that's available Monday through Friday, 8:30 to 5, 1-800-876. Oh, help me say it right, Tasha.
1-800-726-8774.
Thank you. I knew it was going to come out of my mouth wrong. And our call center agents can help you apply for Medicaid over the phone. So if a person is interested in Prime, but you don't have Medicaid yet, SC Thrive can assist you with that. So once we get your Medicaid approved, then all you would have to do is just call us back one more time, and we can help you to enroll in Prime as well. So I'll turn it back over to you, Tasha.
We just want to thank everybody for tuning in today with our Prime webinar. We want to thank our guest, Samantha, for joining us today. And we hope to see you at the next scheduled webinar. Have a great day.
Thank you.